so must be a cystitis. We start to do, well, the referring veterinarian did antibiotic treatment, but is getting better, but it came back. And is not responding to any treatment. Is not responding to anti-inflammatory, is not responding to antibiotic. We are checking in the area of the urinary bladder. Consider that the urinary bladder, no matter how empty it is, should be, the thickness should not be more than 3 millimeters. It's okay to have a little bit of difference in the thickness of the urinary bladder, but this is too thick. So when you get too thick, it's very likely there is some degree of fibrosis, meaning that it's a dog that need to pee very quick. When they start to need to pee, they will pee nearly immediately. So one area that always need to be checked is the neck of the urinary bladder. And when you have dysuria, which is the area that you really want to check? Dysuria is a female. Which area should we check? The tricone, yes, and urethra. It's the urethra that most of the time cause dysuria. How good is ultrasound with urethra? Well, usually we see just the beginning. So we have the urinary neck and the beginning. And then is all the urethra that we can see. We can make the dog standing in a way that with the weight of urine, the urinary bladder is a little bit more cranial, because we really want to check carefully the urethra, because all this is really thickened. But if it's a Stranguria dog, most likely will be a urethra problem. So I'm trying to go as much as possible. I angle caudally, and I should see the urethra disappear. So really, I put my dog standing and I angle really caudally my probe until I can follow a little bit. This is the colon, and this is a very severe focal thickening of the urethra. But it's so far away that I'm in big trouble to try to see clearly. Usually I shouldn't have such a huge urethra. How can I have a better look of this area?
X-ray.
You know, I'm really close to the pelvis. I want to see better, but the bone, there is other acoustic window that can help me to see an intrapelvic lesion. So I already put the dog standing, so this is helping a lot. But what can I do is remember that the pelvis has the obturator foramina. This is a wonderful acoustic window to check at the intrapelvic urethra. So in the pelvis you have these two holes, are ventral, and you just avoid to be in the center. You go just medial or lateral, and in oblique way you can see a bigger portion of the intrapelvic urethra, and you see that this is not really following, but there is a thickening of the urethra. Does a thickening of the urethra will make sense for the dysuria? Yes, will be absolutely a perfect sign. And another window that we have is perineal. So I use the anus, or I use the perineal area to see another part of the urethra, and again, I should barely be able to see the urethra. And I see a really severe thickening of the urethra. And I want more information. That's a lot of vascularization. So I have a focal mass surrounding the urethra. Of course, I want to be more sure. CT. Do you have a CT? Yes, no. If you don't have a CT, you need to use ultrasound. You can also try with contrast study, but this is a nice way. So basically, there were not a lot of money involved, so we did a contrast study to see how long it was. Ultrasound we used to define where it was. We went to surgery, it cut a part of the urethra. This was a benign tumor, but it was compressed in the urethra. So we resolved the problem, and he's still fine. Now he's 13. Okay? So urethra is something that most of the time you will need radiology, but be creative. We have anal window that is fantastic for the retroperitoneal space. We have transobturator window that can show us something that is in the pelvis. Okay, another thing that you might see quite commonly is this.